Welcome everybody to our first session in our apprenticeship series, and starting off with apprenticeships in primary care and how to get started. My name is Kusham Nijhar and I'm an apprenticeship lead working across the Thames Valley area. And my colleague Kate Long, if you'd like to introduce yourself.
Hi, my name's Kate Long and I'm the apprenticeship lead across the Hampshire and Isle of Wight area, so the Wessex side of the Thames Valley and Wessex Primary Care School.
And what we'll be doing over the next 30 minutes is providing you with an overview of the different apprenticeships that are available, that are applicable to or relevant to primary care, and a little bit on how you can get started. So we're going to start off with an introduction and looking at the clinical apprenticeships. We'll then go into the non-clinical, and we'll make a start there. So over to you, Kate.
So just thinking about apprenticeships within primary care, there are approximately 700 different types of apprenticeship programs available, and a large proportion of those are applicable within primary care. And when we think about maybe expanding the workforce and how apprenticeships would fit in that, there's a variety of levels for apprenticeships. So going from level 2, which is GCSE level, right up to level 7, which master's level qualifications. And I think sometimes people forget that actually there is that broad range of levels for apprenticeships. And apprenticeships are for everybody. It's not just for the younger population, 16 to 160. Yes, true. So, it is open to a huge range of individuals. And utilising apprenticeship opportunities can help develop your workforce and retain your workforce. Like I said, there's no upper age limit for apprenticeships, so we get a lot of people come thinking about maybe a career change or further development, and looking at what apprenticeship opportunities they can use for that. There's some funding available for training costs. So for those practices, those primary care networks who don't pay into what's called the apprenticeship levy, there's an opportunity for levy transfer from levy paying organisations, or practices would only have to pay a 5% contribution to their training fees. So there's some support with that as well. And there's also some government incentives for training 16 to 18-year-olds as well, that we could support or give you further information about. And if we think about improving service quality, apprenticeships can provide some really robust development in both clinical and non-clinical apprenticeships. Apprenticeships have what's called an endpoint assessment at the end of their apprenticeship, which is a robust way of making sure that that individual has met all of the necessary requirements to complete their apprenticeship successfully. So if we think about clinical apprenticeships that specifically relate to primary care, we've got a number of apprenticeships that are clinical. So we've got the physician associate level 7 apprenticeship, and that's coming on board later on this year. The advanced clinical practitioner level 7, so that apprenticeship takes 3 years. There's a variety of universities that offer that apprenticeship. It is the same qualification as the traditional taught route for ACP, so you would come out with an advanced practitioner master's. There's also the enhanced clinical practitioner level 6 for those wanting to consider different career pathways. And there's also the registered nurse degree, and that's across all 4 branches, but specifically within primary care, adults tends to be the one that's most used, although we do have a couple of primary care networks who are looking into the mental health nursing degree, which is great. Nursing associate role is really quite popular within primary care. I think that's also about developing the band 4 workforce within primary care, and obviously you've got the associated R's funding that can support practices with that. Assistant practitioner level 5 as well, that's similar to the nursing associate, but obviously from an AHP, allied health professional point of view, so that's looking more along the rehab side of things. And pharmacy tech level 3 as well. That's a really good apprenticeship for those primary care networks that are looking to develop their dispensing technicians and their sort of pharmacy offer within their patient demographic. And we've also got some community health and wellbeing workers level 3 and senior healthcare support worker level 3. So it's useful to sort of think about where your patient demographic is, where your workforce sits, and think about the opportunities that you've got to develop your existing workforce and whether you could utilise some of these apprenticeships to help with that development. And there is a really useful website, Hazo Skills for Health, which is there on the slide. And if you look on that, there's a really useful search box there that you can put in some sort of occupational therapy or nursing degree, and it will give you some more information about the standards, so you could have a look. But I think what Kush and I would both say is, if anybody is thinking about some of these apprenticeships, then reach out to either of us and ask for some more information, because sometimes it can be quite daunting. You start looking at things, it all looks quite lengthy, but Kush and I can help you out with that.
Thinking about the non-clinical workforce, so as your PCNs, your GP practices, are evolving, if we think about the fuller stock take report and how we, are slowly progressing into working into our integrated neighbourhood teams, the opportunities for our non-clinical workforce have also expanded. And there are, as we said, there are 700 apprenticeships, and it can be really difficult to navigate what is relevant and appropriate for GP practices. So we've listed quite a few on here, but this list is certainly not exhaustive. So what we've done, there's 2 slides, we've broken them down by PCN, primary care network, and another one for general practice. But as you would expect, there is a lot of crossover. Management and leadership programs are definitely popular. So in apprenticeships, you can go from level 3 right up to level 7 in your management development journey. We have currently with our practices people on all of these programs. So for the level 3 team leader supervisor, this is a great one for your experienced business administrators. Sometimes for your healthcare senior healthcare assistants as well, where you want them to start learning how to manage a team, even managing an individual and starting them from there. Operations management, we have a lot of practice managers on that program. And this is an interesting one because you don't actually have to be managing teams, managing people. This can be if you are managing multiple projects as well. There are project management apprenticeships. So it is about looking at which of these 2 apprenticeship programs would be the most relevant for the individual and for the business. There are degree management apprenticeship programs, ideally suitable for somebody coming new into say a PCN environment, and you want them to slowly learn the different functions of the business with a view to developing them into a PCN business management role. Or then the senior leader, which obviously would be for your senior leads, but we do have practice managers or PCN business managers that are doing this program as well, because they are working sort of above the foundation management level 5, where they probably already have enough of that experience, skills and knowledge, and actually the senior leader gives them some insight into expanding the business strategy. So when we're thinking about growing our PCNs, growing to federations, growing to neighbourhood teams, and we're thinking about transformation, these are very relevant apprenticeship programs at the moment. Then you have your support functions, so accounts and finance, learning and development, human resources, where you've got a range, again, from level 2, level 3, right upwards. You do need to think about what expertise you have in your business already. So if you want to put somebody, for example, on a level 5, say HR consultant partner level 5 program, do you have somebody within your organisation who has enough experience to impart their knowledge to that individual who's on the level 5 programme. So supervision and expertise is an important one to think about. And then you have other areas like quality, digital transformation, office support and administration. So improvement technician and improvement practitioner. We don't have many on that programme in general practice at the moment, but we do have some, and it does really work well. When you think about CQC and QoF and the variety of different sort of contractual and compliance measures that you have to think about, this programme is really good for your experienced administrators or officers who would be able to take that time out and look at what you're doing as a business function and pulling all of that together. So a great apprenticeship programme for them. And then digital transformation, we've only listed 3 here, but there are so many different programmes under the digital transformation. We think these 3 are the most relevant. Data technician generally tends to be around, for us, it would be around platforms like Excel, so that the individuals can learn, have a deep dive and an understanding of the foundations of Excel, so that they can then start learning the Power BI programs and the different functionality, so that you can start working towards data analysing and matching that to what the population health demographic stats are saying, and give you that richness of data. There is a business analyst level 4 as well, and there are 1 or 2 providers that have pulled the business analysts together, and they've looked at the R's funded digital and transformation lead role, because if you're finding it difficult to recruit to that role, could you develop somebody within your services and develop them there, again thinking about transformation of your services. And then within business administration, there are programs where you can do the generic business admin, but you can also do overlay content with the GPA role, cancer patient tracking and clinical coding, for example. And again, associate project manager and then project management level 6. I think these are really exciting programs for general practice. These are all quite new, so really encourage you to talk to Kate, myself, or wherever you are, your local training hub, to make sure that you are, these programs are going to be successful for your staff. So the next slide is there for you really to navigate if you're general practice. The only real different program that we've listed here is the customer service practitioner for your receptionist staff. So if we're thinking about bringing in somebody new to the workplace or new to a receptionist role, the level 2 customer service is an excellent one to get started. So thinking about your how do you create a successful apprenticeship programme and where to get started. So the first thing that you really want to be thinking about is, why are you developing this apprentice? So that's regardless of whether they are somebody within your existing workforce or whether you want to recruit somebody in as part of a succession planning measure. So really thinking about the why. So what are the skill gaps in your workforce in relation to what your patient health population needs are? What are your workforce demographics? So do you have the right skill mix? Or what do you need? What do you need to develop? Are these people ready out there to recruit? If they're not, apprenticeships really have a good place in terms of your recruitment, but also the retention. And we say that because apprenticeships are a minimum of 12 months. In reality, that tends to be 15 months because of this endpoint assessment that you have to do after your 12-month programme. Many apprenticeships, or some apprenticeships, can go right up to 5 years. So if we're thinking about degrees and then master programmes, or you could create a pathway. So you could bring somebody in on a level 2 programme, progress them onto level 3, jump onto a level 5 foundation, and then do a top up onto a level 6 and then masters. So there's, there are various ways. And if you create a pathway for somebody, you're saying to them, actually, we value you and we want you to be on this pathway of learning with us. So do you have the right skill mix? do you have an aging workforce? Do you have the right level of diversity that you need? So think about what your workforce needs are. Again, do you want to upskill, you know, your existing staff? And we see this a lot, especially in the nursing pathway, where we see people coming in to either a business admin function or a healthcare support worker. And even in the business admin, people are moving into the health care setting, and then they are developing as a senior healthcare support worker, nursing associate, foundation level 5, and then now into topping up as a registered nurse degree apprentice. And we've got various case studies to show you, you know, how that's done, and to showcase their experiences and the benefits that they're bringing to the practices as well. So, you know, how much can you convert a vacancy into an apprenticeship, especially if you're seeing a churn in particular positions? Is it time to do something different? Do you need to convert that vacancy? What I would say is make sure that you've got the right level of supervision, mentoring, support in your practice. Mentoring, supervision, people often ask, how much time will it impact? How much of my time will I need to give away? Well, like you are developing any new person, whether they're an apprentice or not, you would always invest your time. But actually, you've got a whole team around you. So who's got that different skill set that you can bring in? So, for example, if they're doing business administration, you'll have some people that are naturally good at communication skills. You know, think about your care navigators and the conversations they have with patients. You have somebody that are naturally more attuned to the digital platforms and can impart that knowledge, and others who can handle conflict really well. So think about your different people and how you can bring them on, you know, sharing their mentorship skills. And then think about cost and the business case that you need to present to your partners, who tend to be the decision makers, especially when it comes to creating new vacancies. So, you know, if you're spending a lot of money on bank staff and temporary staff, for example, are you better off having a longer term investment in an apprentice where they will stay and actually quite quickly learn the ropes? So is that a better strategy? Retention, you know, there is this assumption that apprentices will study and then leave, and we're just not seeing that at the moment. Our retention rate at the moment is sitting at around about 80 to 85%, depending on the different programs. So again, quiz Kate and I around this, and then maybe we can help you with a cost benefit analysis. And again, on the HASO website that Kate mentioned earlier, there are some tools to help you think about building up a cost benefit analysis in a business case. How many staff can you have on training at any one point? So as much as, you know, we say, yeah, everyone should do an apprenticeship, but actually, if you've got students in and you know, you've got other people on professional qualifications and then the apprenticeship, you know, just making sure that you've got the right balance across your teams and that it is manageable. Apprenticeships, there is a requirement for 6 hours off the job training. But of course, that looks different depending on the program that you are doing. So it is not always one day out of your service every single week. It doesn't work like that in all apprenticeship programs. And in particular with the non-clinical apprenticeship programs, the way you achieve those 6 hours can look quite different. So again, just need to do a little bit of homework on that. There's resources on a web page that are linked in this slide set. And again, Kate and I are here for you to ask. And if space, the physical space in your GP practice or any of your buildings is a challenge, what are the alternatives? Okay, because you need the workforce. That issue is not going away. You need the space. And in the short term, that issue is also going to still be there. So what are the alternatives? And some employers are looking at hybrid remote working models using satellite hubs and sites. So, you know, does that individual need to be on site, you know, 5 days a week? So, or is there an alternative? So coming to the end, so just a list here of the future programs that we will be running, and the booking information. There is a link below this video. And then on how to get started, so there is a website on the Thames Valley and Wessex Primary Care School, and sort of different resources on there, where you can simply email us. if you're looking around for further information, there are additional resources on the Frimley Training Hub website. So, for example, if you're particularly interested in the level 6 and 7 management development programs, or if you want some more insight into how to get started on pharmacy technician. So there's just some additional resources that are on the Frimley Hub website currently. If you're looking for case studies across both the clinical and non-clinical programs that we've talked about today, there is a YouTube video, and we are on the social media platforms. We're particularly interested in if you have success stories around your apprenticeship journey, or if you've supported apprentices within your organisation. We're always looking for how apprenticeships have positively impacted, but equally, if it has been a struggle, you know, how have you got through it? How have you got through the other side? So we would love to hear from you. And that brings us to the end of the presentation today. And if there's nothing else from you, Kate, and then
no, nothing.
Right. Yeah. Okay. Thank you very much.
Thank you.